she thought it was just age. That slight blurring at the edges of her vision, the way lights seemed to have halos around them at night, the occasional flash she'd notice when she turned her head too quickly. Her doctor told her to rest more. Her family told her to get stronger reading glasses. For 2 years, Margaret ignored what her eyes were trying to tell her, until the morning she couldn't recognize her own daughter's face standing 3 feet away. What happened to Margaret isn't rare. It's heartbreakingly common. The human eye is not just an organ of sight. It is a window, a living, transparent portal into the deepest architecture of the body. The blood vessels running through the retina are the only blood vessels in the entire human body that can be observed directly, without surgery, without cutting through skin. That makes the eye one of medicine's most powerful diagnostic tools. And yet, millions of older adults dismiss their changing vision as an inevitable tax of aging, never realizing that what they're seeing, or not seeing, could be the earliest warning sign of a stroke, diabetes, high blood pressure, or even a brain tumor quietly growing in the dark. Let's start with something that sounds almost poetic but is anything but sudden vision loss in one eye. Imagine waking up one morning and looking out your window, and the world on one side has gone gray. Not dark. Not completely black. Just washed out. Muted. Like someone turned down the color on half of your life. This symptom, which doctors call transient monocular vision loss or amaurosis fugax, is often the eye's desperate attempt to sound an alarm. The culprit is frequently a tiny blood clot or piece of arterial plaque that briefly blocks blood flow to the retina. It may last seconds. It may last minutes. And then, cruelly, it disappears, making it easy to dismiss as tiredness or a fluke. But here is what the medical community knows with frightening certainty: this symptom, even when it resolves on its own, is one of the strongest predictors of an impending stroke. Studies have shown that individuals who experience transient monocular vision loss face a significantly elevated risk of a major cerebrovascular event within days to weeks. The eye was not malfunctioning. The eye was screaming. Then there are the floaters, those drifting, cobweb-like shapes that drift lazily across your visual field. Most floaters are benign, caused by age-related changes in the vitreous gel inside the eye. But when floaters suddenly multiply, when they arrive in a storm rather than a trickle, when they're accompanied by flashes of light like a camera going off inside your skull, that combination is a medical emergency. It signals a possible retinal detachment, where the retina begins to pull away from the back of the eye like wallpaper peeling off a wall. Without treatment within hours, permanent blindness can follow. And blindness, as Margaret would later tell her daughter with tears in her eyes, is not just the loss of sight. It is the loss of faces. Beyond the dramatic, the sudden losses, the flashing lights, there are quieter symptoms that the body delivers with far more patience and far more danger. These are the symptoms that don't announce themselves with urgency. They arrive slowly, the way winter does, one cold morning at a time, until one day you realize you're deep in it and don't remember when it began. Double vision is one of those symptoms. When an older adult starts seeing 2 images where there should be one, the instinct is to blame tired eyes or the wrong glasses prescription. But persistent diplopia, the medical term for double vision, can point to something far more serious lurking behind the eye. The nerves that control eye movement, particularly the 3rd, 4th, and 6th cranial nerves, are exquisitely sensitive indicators of neurological health. Compression of these nerves by an aneurysm, or damage from uncontrolled diabetes or high blood pressure, can cause the eyes to fall out of alignment without warning. In some cases, double vision is the first visible symptom of myasthenia gravis, an autoimmune disease that slowly steals the body's ability to control its own muscles. There's a particular pattern doctors have learned to watch for: when double vision worsens throughout the day but feels better in the morning, that fluctuating quality, that exhaustion of the visual system, it whispers the name of myasthenia gravis with troubling accuracy. Now consider the gradual loss of peripheral vision. It happens so quietly that most people don't notice it until they've lost a significant portion of their visual field. They start bumping into things on their left side. They miss objects on the edge of tables. They feel vaguely anxious driving, not quite understanding why the sides of the road seem to have disappeared. This is the signature of glaucoma, a condition in which elevated pressure inside the eye slowly crushes the optic nerve, the cable that carries everything you see directly to your brain. Glaucoma has earned a devastating reputation in medicine. Not because it is untreatable, it is, when caught, but because it is silent. Unlike a retinal detachment or a sudden vision loss, glaucoma does not hurt. It does not flash or blur dramatically. It simply erases the edges of your world, degree by degree, year by year, until the tunnel of remaining vision collapses entirely. By the time most patients notice something is wrong, they have already lost up to 40% of their optic nerve function. That function does not return. The nerve fibers of the optic nerve, once destroyed, do not regenerate. What glaucoma takes, it keeps forever. But glaucoma is only one chapter of this story. Because sometimes, the field of vision that goes missing isn't on the sides, it disappears in a specific, almost geometrically precise pattern that tells a neurologist exactly where in the brain something is going wrong. A condition called bitemporal hemianopia, where both outer visual fields go dark while the center remains intact, points with haunting accuracy to pressure on the optic chiasm, the X-shaped crossing of optic nerves at the base of the brain. The most common cause? A pituitary tumor pressing upward from below, like a fist slowly pushing through a floor. This is why neurologists, endocrinologists, and ophthalmologists often work together in careful collaboration. The eye is not isolated from the body's story. It is written into every chapter of it. Then there is dry eye, a condition so commonly trivialized that it has almost become a punchline in discussions of aging. Oh, just use some drops. But chronic, severe dry eye in older adults is increasingly recognized as a potential early marker of systemic autoimmune conditions, particularly Sjogren's syndrome, a disease in which the immune system mistakenly attacks moisture-producing glands throughout the body. The dry eyes come first. Then the dry mouth. Then the joint pain. Then, in some cases, complications involving the kidneys, lungs, or nervous system. An older woman who walks into a pharmacy looking for eye drops may be standing at the beginning of a diagnostic journey she doesn't yet know she's on. Her eyes are already trying to tell her story, if only someone would listen closely enough to hear it. There is something profound, and quietly devastating, about the way the body uses the eye as its messenger. Because the eye doesn't lie. It doesn't compensate the way the liver can, it doesn't reroute the way the brain sometimes does after injury. What happens inside the eye reflects, in real time, the health of systems far beyond it. And nowhere is this more true than in the relationship between the eye and the cardiovascular system. When a doctor looks into the back of your eye with an ophthalmoscope, they are looking at your arteries. The retinal arteries are direct extensions of the cerebral circulation, the same blood supply that feeds your brain. When high blood pressure has been silently damaging the body for years, it leaves its fingerprints in the retina in ways that can be read like a medical autobiography. The arterial walls thicken and become tortuous. They begin to compress the veins crossing beneath them, a finding called arteriovenous nicking. In advanced cases, the retina itself begins to bleed, and white patches called cotton wool spots appear, each one representing a small area of the retina suffocating from a lack of blood flow. These are not just eye findings. These are brain findings. These are heart findings. Research published in leading cardiovascular journals has established clear correlations between retinal microvascular changes and the risk of heart attack, stroke, and cognitive decline. The eye is not reacting to cardiovascular disease as a bystander, it is participating in the same pathological process, and showing the damage earlier and more visibly than almost any other organ. This is why a routine eye exam, in the right hands, is so much more than checking whether you need new glasses. It is a surveillance mission. It is the closest thing medicine has to a live broadcast from inside the body. Consider sudden eye pain with nausea and halos around lights. This triad is the textbook presentation of acute angle closure glaucoma, a medical emergency in which fluid pressure inside the eye spikes to catastrophic levels within hours. The eye becomes hard as a stone. The pain is searing, often so severe that patients vomit. The halos around lights happen because the cornea, flooded with fluid it can't drain, begins to swell. Permanent blindness can occur within a single day if treatment is not received. And yet, because the nausea is so prominent, patients and even some emergency physicians have mistaken it for a severe migraine or gastrointestinal illness, delaying the treatment that could have saved everything. The eye also speaks about the brain in one more quiet, chilling way, through what is called papilledema, the swelling of the optic disc. The optic disc is the point where the optic nerve enters the eye, and it sits in direct communication with the fluid that surrounds the brain. When intracranial pressure rises, from a brain tumor, from a dangerous condition called idiopathic intracranial hypertension, or from bleeding inside the skull, that pressure travels down the optic nerve and pushes the disc forward, causing it to swell. A skilled ophthalmologist or neurologist looking at the back of the eye can literally see the brain's distress reflected in that small, pale circle at the retina's center. There are people alive today because an eye doctor noticed their disc looked slightly swollen during what was supposed to be a routine prescription update. There are people who aren't, because no one looked. The older we get, the louder the eyes speak, and the more critical it becomes that we, and the people who love us, know how to listen. A sudden change in vision is never just a change in vision. A new floater in isolation may be harmless, but a flood of floaters with flashing light is a 5-alarm emergency. Double vision that comes and goes is not exhaustion, it is a neurological conversation that deserves an urgent response. Peripheral vision that quietly narrows isn't a quirk of aging, it is glaucoma writing its name on your future. The message of modern medicine is not meant to frighten. It is meant to empower. Because here is what is also true, nearly every condition discussed here is treatable, often remarkably well, when caught early. Glaucoma can be managed with drops, laser, or surgery to preserve the vision that remains. Retinal detachments, treated within the critical window, can be repaired with outcomes that still feel miraculous. Stroke risk identified through transient vision loss can be dramatically reduced with medication and lifestyle intervention. Pituitary tumors can be removed. Hypertensive retinopathy responds to blood pressure control. Sjogren's can be managed. The eye, which so often delivers devastating news, is also, when we listen to it, one of the greatest gifts of early warning the human body possesses. Margaret eventually had surgery. She regained partial vision. She can see her daughter's face now, imperfectly, beautifully. She says she will never again call a vision change just aging. Neither should you. Neither should the people you love. If this video made you see your health differently, or reminded you of someone who needed to hear this, please give it a like, it helps this reach the people who need it most.